Hey, Dr. Lindsey and Wendy here. This is another one of our repair of an FUE cases with a small strip. And for you newcomers who haven't seen our videos, I think there's 235 of them now. Scroll back a little bit, then there was a wave last year of maybe 10 or 15 videos in a row of, maybe not in a row, but pretty close to in a row of us repairing FUEs done from all over the world. And sure enough, this fella came, and he's like a 40-year-old executive who had gone to a well-known European FUE doctor and had this done. And it's just low density. Well, I think in addition, his hairline's too low. I probably would have done it a little differently. But once you've committed to that hairline, then it's just not enough hair, right?
Yes. I mean, he likes it now.
Well, he likes the hairline, yeah.
Yeah. I mean, every young guy that comes and see you, anyway, they want their hairline low.
But at some point, it goes back. And so in 20 years, he may wish it was a little higher. But that's the hairline they gave him, but it just wasn't enough hairs. And the etiology for that, if you look at our bunch of videos, is not enough hair per square inch, or transection of the FUE grafts when they were removed, or just simply stressing the hair roots when you rip that hair out. And you mean rip because you're making a hole around each hair and avulsing the root. That stresses hair roots, and just like it stresses plants.
The hair is more weak,
yeah.
So it's less likely to survive.
Right. So we cut a little strip out of the back of his head, and you can see from this picture he does have a little donor depletion. So they definitely got hairs when they did it. And then you packed him in. That's packed in there, Wendy.
It looks good.
Yeah. And so he's now 8 months out, and he emailed me this picture that I just cropped his face off of. But that's 8 months out, certainly not fully grown in. He looks awesome.
It looks
and
great.
He's really happy. And so this food for thought. If you're going to get a hair transplant, make sure you pick the one that's best for you. We definitely do FUEs, but I think it's important to realize the pros and cons of those. Next is plan for the future. I think that hairline's a little low, but that's what he's got. But fortunately, he doesn't have much hair loss in his family.
He doesn't.
Yeah.
Yeah. Can you explain that? So I think a lot of patients come in and you say, I'll give you a hairline similar to mine. And then, but I don't think they don't understand why you want to give them such a high hairline.
Well, that's not high, but it's very... So eventually, all you young guys who are looking at this, who are 25 and want a hairline that's down here,
Like
if you had that hairline when you're 53, like I currently am, you'd look like a maroon.
That's one.
I don't know what else there is to say.
Number two, it's like if you spend so much hair bringing that hairline so low,
right?
What happens?
So, and if indeed you're going to go really bald, you need all the hairs you can that you have to build whatever hairline we can do. And so if you're going to be a class 7 or class 6 hair pattern patient, you can have a hairline. You'll just have a little line in the middle of the desert. You need to put a hairline roughly where mine is, or maybe even higher if you have less donor heads.
Yeah. Okay. So because I had to explain that to my friend that lives close to me and had a hair transplant. Okay. He always says, my second, he's starting to grow a little bit here already. He's like, my second one, can you bring this low? But then he's thinning back here. And I am...
Well, this is our smoker that's got the best going.
Yes.
Yeah.
Yeah. I mean, he is determined that he wants us to lower the hairline. I mean, you see him. He comes every month just to make sure that he's ready for the second one.
Yeah.
So he wants us to lower the hairline, but he is thinning out here.
Yeah, it's not going to happen. He's got a finite amount of hair. I mean, he somehow has access to a lot of money, but this is the finite resource. And you have to spend it frugally. And oftentimes that means putting a hairline roughly where mine is, and if you're lucky enough that you don't have more hair loss, then you can always go a little lower. So a couple things. One is take a look at this FUE repair with a strip. And two, if Wendy and I can help you, please give us a call. Thanks.